Good morning, good afternoon, good evening to everyone on our webcast today. I'm Jonathan Edelheit, the CEO of the Medical Tourism Association and a director of the Global Benefits Association. And we have an excellent webcast for you today called Centers of Excellence in Global Health Insurance. And today's webcast is in presentation with Bupa, a leading international healthcare group, which I'm sure most of you have heard of, serving over 14 million customers in more than 190 countries. And they will be talking about solutions for employers in healthcare and healthcare consumers in looking for access to quality healthcare. So some of the things we're going to cover today in today's webcast is going to be centers of excellence in global health insurance policies and what is their trend in growth as well as cost. The difference between individuals purchasing insurance policies individually versus through employers, and what are individuals traveling to, where are they traveling to, what are the future trends in regards to growth of these policies. And if you could just give me just one moment, because my PowerPoint just disappeared, so I just need my IT person to bring it back. Thank you. So today we're going to be presenting with, I'm excited to have our co-presenter, Jose Quesada, Medical Director for Bupa International Private Medical Insurance. So one of the things that we kind of want to cover is obviously health plans, insurers, and multinationals have gone global. We all know we're in a global healthcare economy, and we have a global population that they're either traveling because they're in a mobile workforce, or there are individuals who are willing to travel and go mobile because they want to receive high quality care, affordable care, or they have a perceived value, and that value defines what they're really looking for in care. And individuals, they're no longer content to receive care locally. They have access to information that they did not have 10, 20 years ago, so they're now more open and willing to traveling outside of their city or their state or their country for care. And so the question is, how far will they travel and why? And so one of the things to think about is how do people choose, when it comes to healthcare, where they're going to go for healthcare? And, the major trends of the influencers of why people choose doctors or hospitals, whether they're local or whether they're traveling to other countries, is it's word of mouth from either family or friends. They're learning it from newspaper, radio, magazines, or some other online media or news source. They're learning it from their health insurance company, which is really one of the most trusted sources that they have, because you purchase your health insurance, you trust in your health insurance company to identify the best facilities and doctors to work with. And you're getting referrals from your doctor, and also you're getting referrals from your employer. So with that, if we look at kind of what's the definition of the Global Center of Excellence, and there's many definitions out there, but I think kind of a general definition of a Global Center of Excellence is a facility, healthcare facility, that's dedicated to providing the highest quality of care for patients, healthcare consumers, in specific specialities. And this includes adhering to a set of standards which exceed those for the destination, meaning that a center of excellence will have higher standards than your normal healthcare provider or hospital or clinic in that location. And then there's the Centers of Medical Adequacy, which is a growing emerging terminology in the global health insurance space. And that is where health insurers are, instead of sending patients potentially to centers of excellence, they're sending them to do centers of medical adequacy, which are medical destinations that have an adequate predetermined level of quality, but not rising to the level of care and excellence that a center of excellence would provide, and they're obviously more affordable. So I wanted to give an example of global health insurance policies, because this is what we're seeing emerging in a greater demand from middle and upper class and multinationals who are purchasing these health insurance policies to give them the availability to travel. So the next 3 slides are different plans from the same insurance company in the Middle East. So if we look at this, this is a plan with an annual limit in the United Arab Emirates of $5 million, or in U.S. dollars, $1 million, around $360,000 for the year. And you'll see emergency treatment coverage is covered worldwide. you'll see at the bottom the territorial limit where they can get coverage is also worldwide, which means they have over $1 million in coverage, and they can kind of go anywhere in the world. So this would kind of be the premier coverage, which would cost and be the most expensive for someone who wants to make the choice of where they get care. With the next slide, this is the gold plan, and this plan covers in the United Arab Emirates $2.5 million, or in the U.S. $68,000 per year. And you'll notice at the top it says it covers 4,500 providers, excluding the U.S. and Canada. And then down below, territorial limit, worldwide, excluding USA and Canada. Why? Obviously, the USA has the most expensive costs in healthcare in the world. And then it says the network outside of the UAE, once again, is anything excluding U.S. and Canada. So the coverage is more limited, but it excludes U.S. And Canada. If we then look at the third plan, this plan also just covers patients domestically. So that shows you how there's 3 different policies. The first one, anywhere in the world. The second one, anywhere in the world except U.S. and Canada. The third one is just in the United Arab Emirates. So when you look at the network, it says within the UAE, network outside the United Arab Emirates, it's not applicable, it doesn't apply. But what they get above is, if you read at the top, they get a second opinion from global medical experts. So that's kind of an example, and this is a trend we're seeing with global health insurance policies. But obviously they're emerging, they're becoming much more niche in specialization, and this is a little bit about what Jose is going to talk about, and things that Bupa is doing, kind of cutting edge and leading, being kind of that leading provider on a global basis. So with that, I'd like to turn the rest of the presentation over to Jose Quesada.
Thank you, Jonathan. I think today we're talking about a very exciting topic. I think in many venues around the world, people keep talking about how they can access the best healthcare in the world. And that's exactly what Bupa is, the company that I work for, is in the business of. First, I'd like to move to the following slide, and let me see how can I do this. Good. There we go. Let's touch a little bit on the reasons why our patient moving across borders. One is definitely the perception that hospitals or healthcare providers in other countries are of better quality, or they have a faster response to their needs. And let me put a couple of examples. You mentioned that U.S. is one of the most expensive markets in the world. However, whatever you ask, people think that the U.S. has a very high quality in terms of healthcare. So some people come to the U.S. because they're looking for that sense of quality. In terms of faster response to their needs, we can talk about markets, for example, Canada or the UK, where there are long waits to get into the public healthcare system. So therefore, people look for options outside their countries to get that customer service, faster response to their medical needs. Then another important aspect for people to consider when they're traveling is they definitely have an international health insurance plan. And on top of that, they need to have the financial means to cover it, lodging, transportations, and anything that is related to that travel. And there are efforts, as you mentioned in the example for the UAE, for companies to expand the customer base and look for different price points depending on providing global, regional, or local coverage. So that is a trend that is going to affect the markets in the future, bringing more customers with these type of propositions. Therefore, we're going to see more people traveling across borders. And then probably one of the most important aspects is technologies. We can, for example, when we look at markets such as the Caribbean market or Africa, where we see that the provision of health care is not up to the levels that they should be, people don't find the technology that they need to take care of their medical condition. Therefore, they need to get on a plane and travel to different destinations. And I can say that Usually people travel looking for solutions for complex medical conditions such as cancer, spine surgery, or cardiovascular conditions. But you also see people traveling for other reasons in terms of technologies. They're looking, for example, in terms of cosmetic surgeries, they're looking for those destinations that are experts in cosmetic surgery because they don't have that technology at home. And on the following slide, I'd like to talk about the different, and these are top destinations based on our experience. For example, we don't see India here because in our book of business we don't have a lot of presence on IPMI in India. We have a strong presence in PMI, but not in IPMI. But and let me make a big difference between what I consider a top global destination and a top region destination. For example, USA, UK, France, Germany. Those are global destinations. Those are destinations that get people from all over the world that travel there for medical care. Definitely the U.S., we have top U.S. academic medical centers. They're doing a lot of efforts in answering questions. They have the absolutely outstanding technology. Therefore, they get people from all over. In the UK, there are
someone asked something, I'm going to say it.
There is a Bupa hospital that get a lot of patients from the Middle East. And then we have regional hubs or destination. I can mention Brazil. Brazil gets patients from Bolivia, from Paraguay, from Uruguay, even from Venezuela.
You don't hear?
You have Hong Kong or UAE that they get
I just lost him for a few seconds.
So, these are top destinations, and these there's high competition in terms of the providers offering in those different countries. And this slide is just to, again, reflect on the point that you mentioned, John, that the U.S. is one of the most expensive markets in the world. And I have selected 3 services that are of high volume anywhere in the world. Normal delivery, knee replacement, and bypass surgery. And you can see on the right side, the U.S. is well above any other countries in this sample. And that is, when we talk about giving in a product the benefit to access the U.S. healthcare market, that's one of the main reasons to have a high premium compared to other products that do not offer coverage in the U.S. So what's happening, or what is going to happen over the next 5-7 years in the IPMI market? We have seen economies such as Latin America and Asia that they're growing. The middle class is just booming. And not only they have the economic means, but also it's a more educated consumer. Social media is playing a role in that. The access to information easily available on the internet is making that these consumers are not only have the purchasing power to get into the market, but also the education to understand healthcare better. Therefore, they're looking for high quality. They want to go to the places that they can get top services. There are opportunities for growth in different market segments, and we can talk about the expats. That's has been a common market, but that market is expanding, especially expats from the U.S., from the U.K., traveling to different regions around the world. That is a market with huge opportunities in the future years. The retirees, high net worth individuals, older, for example, the students, those are market segments that are going to be continue growing over the next few years. Then obviously we have on the cost side some challenges. Aging population, especially baby boomers around the world, they put a pressure on providers. These are people with chronic medical conditions, therefore they're demanding more services from providers, and therefore rising costs. Personalized medicine. Medicine is becoming more personal. A good example is the pharmacogenomics. The drugs are being tailored to specific individuals to avoid drug reactions, and the entire genetics analysis and studies that go along with that, that is making healthcare, or is going to make healthcare even more expensive. And then we always talk about how the technology is making healthcare more expensive. It's not technology per se. It's the slow adoption of technology. And then let me give a quick example. When the iPhone came a few years back, the adoption was really fast, and the price dropped immediately from $600 to $200 on average. And that rapid adoption of the technology is helping manufacturers to reach economies of scale. That is not happening in healthcare. In healthcare, it's always a late adopter of new technologies. We have organizations such as the FDA in the U.S. with such a cumbersome process, and it's really difficult with the fast access to technology. And a good example is the electronic medical records, still not widely available worldwide, even though we know that it's a great tool to help improve quality. And another important trend is the standardization of healthcare delivery. And I can go back to the slide where we had the C-section, the knee replacement, and the bypass surgery. Those are procedures that are well known for a few years back. There are clear clinical pathways to deal with those. So hospitals are standardizing their clinical pathway. They're standardizing their clinical procedures to make sure that they can reach those economies of scale, therefore bringing price down. And the adoption of evidence-based clinical protocols is also helping to assure that patients are getting what is the best technology out there, what is the best clinical pathway, therefore reducing costs and improving quality. So many centers around the world are working toward implementing those. And Jonathan mentioned the Center of Excellence, and you know, many people talk about Center of Excellence, and there are many definitions. However, you know, a true Center of Excellence is a service delivery model first. It's a way to deliver healthcare services in a way that is focused on a specialty or subspecialty with a multidisciplinary approach. It means that when the patients get into the hospital, there are several specialists and subspecialists in that particular medical condition that are experts, and they're going to look at the case as a whole, and they're going to come up with a treatment and diagnosis for that patient that is based on clinical standards. So we can have Center of Excellence, for example, for breast cancer or cardiac arrhythmias or spine surgery. And the blueprint to build a Center of Excellence is that every single time it applies to the patient what is an international recognized clinical practices. Therefore, walking away from the variation that affects pricing in healthcare and also affects quality. Another important factor is to have high volume. It's different to do 1,000 cases in a year than to do 100 cases in a year. And therefore, learning from that practice and incorporating that learning into the clinical practices again. It's also a center that is going to measure outcome and benchmark that outcome against other metrics and make sure that delivering within what was expected for that particular medical condition. And something that is also very important, a Center of Excellence is to have an approach in terms of bundle payments. Since this is an effort between the hospital and the different healthcare professionals, they all need to get together and work in a bundle payment that will foster efficiency, that will create incentives to provide a service that is high quality and efficient in terms of cost. Let me go back a little bit, move too fast. So what the APMI player should needs to consider over the next few years, what are the capabilities that they need to serve this growing demand and new educated customers. First, they need to have a global provider network because these customers, they want to travel all over the world for healthcare services. But the most important characteristic of that provider network is that it needs to be assessed by quality and efficiency of their services. you need the IPMI players need to understand when they're referring their patients to a particular provider, what are the quality level of that provider and the efficiency in terms of cost. That is going to help generate or have the ability to come up with new products that are more affordable and that are, definitely provide better value to customers. It is also important, especially on the B2B, on the corporate segment, to work and develop specific networks according to the needs of those corporations. For example, if we're talking about the oil industry, those are customers that need provided networks that are close to them, however, with high quality. If we're talking about the maritime industry, these are going to need probably a more global providers network, but again, the quality component needs to be always there. And then you need to continue educating your customer, provide tools, medical information, and design products that are going to help people live healthy lifestyles and managing their medical conditions, especially those chronic conditions. And then we can separate the providers in this matrix between quality and efficiency. So obviously on the where we have the top providers is where you have high quality and low efficiency. And when you need to work with your provider, understand them, engage them in a conversation about quality, about efficiency, and make sure that all your providers are moving toward that quadrant where you have probably the best benefits for your customers. We at Bupa developed, together with Joint Commission International a few years back, a tool for us to assess the quality of our provider network. It's a tool that was so far we have evaluated over 400 hospitals worldwide, and it's a tool that engages us in a different topic and in different conversation with providers, because when we start a conversation about quality, everybody is interested in making sure that customers get the best care, but also it helps us to work with them and help monitor different indicators to continue. This is a program that we evaluate providers every 3 years, so it's a continuous improvement program, and it has been accepted globally, with success. So I think it's a fantastic tool for the IPMI players to engage in the conversation with hospitals and clinics. So now I turn to John to continue with the presentation.
Thank you, Jose. Great presentation. We're excited, the Medical Tourism Association, to be partnering with Bupa for the first Bupa Global Provider Summit, which is going to take place November 2nd within the World Medical Tourism and Global Healthcare Congress this year. It's an exclusive invitation-only event, those participating will be hospital administrators and clinical leaders from some of the most dynamic hospitals and clinics in Latin America and beyond, discussing emerging trends and offering solutions for the delivery of healthcare and medical insurance services. And then those participants and registrants that are part of the Bupa Provider Summit will also be able to participate in the Global Medical Director Summit within our Congress. We're going to be taking questions and answers in just a minute. I'm just going to run through a couple slides first regarding the summit. So this time, too, as I'm going through, if any of you want to type any questions, please feel free to do so. So some of the agenda topics we'll be covering during the Bupa Global Provider Summit is bundled payments, which is an emerging trend globally, continuum of care protocols for international patients, transformational performance improvement of hospitals, hospital quality program and the Bupa preferred providers, and collaboration between payers and providers, which I think is a really important topic, getting more dialogue and communication and everyone on the same page. Everyone wants improved quality, improved outcomes, and that collaboration is important. We have really an excellent group of national and global leaders speaking, from Richard Bomer, senior lecturer at Harvard Business School, talking about the hospital within the hospital. Mark Smith, President and CEO of the California Healthcare Foundation, talking about bundle payments. Dr. Kevin Huffman talking about continuum of care protocols for international patients. And Dr. Andrew, who's Director of Hospital Performance Improvement for Berkeley Research Group, talking about transformational improvement. And Fred Lee, who happens to be probably one of my favorite speakers, author of If Disney Ran Your Hospital, 9.5 Things You Do Differently, and he'll be talking about going from good to great in patient perception. He's really an amazing speaker and New York Times bestselling author. So I hope all of you on the call today will join us for the event. It's going to be our biggest yet in Vegas, November 3rd through the 6th. We're expecting about 2,000 attendees, and I know participation is up significantly. We're going to have participation from about 100 different countries. We have a lot of exclusive summits this year, from the Ministerial Summit, Medical Director, Global Medical Network Director Summit, Medical Tourism Research, and then we have a bunch of forums for different hospitals and regions, from like U.S. hospitals to Latin America to Asia, African, for all the different regions, and European hospitals. So we're going to be having many roundtables where we're going to get more collaboration, discussion going in the industry. And then for those of you that want to try to take your education and career to the next level, we're going to have certification on Wednesday, November 6th, where you can sit in the class all day, take an exam, and become a certified medical tourism specialist. So with that, we will turn it over to questions for anybody who has any questions. You know, one question I have for you, Jose, is I know that we're seeing healthcare costs, increase, significantly. They keep growing. Do you see at any point healthcare costs leveling off, or what really needs to be done on a global basis to kind of, start stemming that rising cost of healthcare?
That's a great question, John, and I think it's up to payers, and when I say payers, I'm talking about insurance company, governments, whoever is paying for healthcare, to keep demanding for high quality and cost. And on the prevention side, it's very important to look at different models of service. Definitely, we talk about the Center of Excellence. The Center of Excellence is a way to reduce costs and increase quality. And let me give you an example. Well, we talk about knee replacement surgery. If we instead of having a huge hospital that is trying to do everything, which is not efficient, and we have proven that, and that's one of the reasons for causing healthcare to continue increasing. If we move away from a big hospital with a lot of people inside there, very expensive organization, and we break the hospital down into Center of Excellence, which are small centers dedicated to particular medical conditions. For example, we create a Center of Excellence for knee and hip replacement, where we have the best surgeons that they're doing only knee replacement, only hip replacement. They put together clinical protocols, clinical pathways that are proven to be to produce the best outcomes for those two procedures. And then we work with suppliers of medical devices, the prosthesis needed for these type of surgeries. And we work with them and we select which are the best ones for the patients in terms of cost, in terms of quality, in terms of outcome. That is a way for us to change the continue increasing in healthcare costs. We need to move away from the large hospitals that they're trying to do everything and get to these focus factories. And it's one of the topics that Richard Bommer is going to touch in the BUPA event. He's going to talk about the concept of the hospital within the hospital. When I'm saying to walk away from the hospital, it's not to tear down the hospital. It's to build inside those enormous organizations these focus factories that are specialized in certain medical conditions, and they align all the resources to make sure that the service is provided in a standardized fashion. Therefore, the cost will go down. I think that's what we need to see to really break that trend in increasing healthcare costs. And the other topic that I mentioned is the adoption or the fast adoption of technology. Medical records is a good example. Medical records are proven to be absolutely great to improve quality. Let me give you an example. When you are traveling around the world, you have your ATM card, and anywhere in the world that you go, you use an ATM, you have access to your personal bank information, you know exactly what you have in your account, you can move funds between your accounts. However, when you are a patient and you are in a faraway destination, they don't know what's your medical history. They don't have access to that information. So we need to adopt technology faster in order to also help break that trend down.
Now, Jose, when you're talking about, electronic health records and medical records, I know this is a big challenge globally, and it's not something that's a global solution that's out there. And we've even seen very large companies come into the space. Google had their own health record. Microsoft came out with Health Vault. They all expected a lot of adoption. What is Bupa doing in that area? Do you have your own solution? Is it global, or is it something that's being developed?
Well, that's something that we're looking into as part of our midterm strategic plan, how we can have a medical depository of our customers' information. We have some in different regions of the world, but it's not connected, and that's probably the challenge. So we're going to be working on connecting all those medical databases in order for our members, whenever they go, we will have access to their information, so therefore we can help them in that particular moment. So that's what we're trying to do in the IPMI arena.
One question that came up was there was different questions regarding different countries in Bupa, so I'll kind of summarize it into a general one, and that is, where does Bupa offer coverage? Is it anywhere in the world? Because some questions came in that said, if I'm in Australia, can I buy a Bupa policy that covers me anywhere in the world? And a similar question came about Dubai and Mexico. So who has access to the Bupa international policies?
Yeah, we have local operations in countries like UK, Spain, Australia, New Zealand, Poland. We are probably the major player, not only in funding but also in provision. And then we have also the IPMI market unit, which I'm the medical director, and the IPMI market unit is in charge of providing that international component to our local operations. In the IPMI market unit, we are over in 190 countries. So anyone that wants to have an international policy can either purchase an international policy directly from the IPMI, or a customer in Australia that has Bupa Australia, or in Spain that has Bupa Sanitas, and they want to have that international layer add to their product. That's something that we're able to do. We have to recognize that people are mobile. That's why we're having this conversation today. And that trend is going to increase over the next few years tremendously. And that international layer is exactly what we're doing to help customers get to the best health care that they want to get to.
When you were talking just a few minutes ago, about the one speaker for the Bupa Provider Summit, talking about the hospital within the hospital. How receptive are hospitals to understanding that concept and working with Bupa in that area?
I was surprised. It's a new concept. They are Center of Excellence in the U.S. I can mention, MD Anderson, what they're doing in terms of cancer care is exactly that. It's a hospital within a hospital. It's a Center of Excellence dedicated to either lung cancer, colon cancer. So that's a great example. So when we talk about this globally, our experience in the conversation that we have had with providers is that they are absolutely open to this. I can mention one example in Brazil. There is a hospital there that just created a Center of Excellence for spine surgery. So I can tell you that the providers are taking this, with absolutely an open mind. I think they see the value. There are key components to this. One is the hospitals are seeing this as an opportunity to work with their physicians and build a team that can provide better services. They're also seeing that this as an opportunity to engage with suppliers of medical devices and drugs and to help them reduce the cost. And they're also seeing this as an opportunity to increase volume because people do recognize that they become experts in a particular condition, and that's exactly one of the reasons people want to travel. They want to get to the best care. If my son is sick, I want my son to be seen by the best in the best. And when we are seeing this trend moving forward, we're going to, as a consumer, we're going to have the opportunity to access information that tell us where is the best of the best expert for my son. So I think this is revolutionary in terms of healthcare, and I believe that this is the future.
And how do people, I understand Bupa is being very selective in your Center of Excellence model. So, what advice do you give people out there, whether they're multinational or an individual? Because I know there's a lot of hospitals that market themselves as centers of excellence or specialization where they've determined it internally. There's not any outside organization. And then I know if we look, for example, even at the U.S. insurance marketplace, when you look at some of the major carriers, whether it's Cigna or United Healthcare, sometimes some of them will have like 70 to 90% of the hospitals within their network they're saying are centers of excellence. And I think we know that, 70 to 90% aren't really centers of excellence. So how does someone determine that they're a center of excellence, or how would you guide them on being cautious and making sure that they really are one?
Well, I think first, John, Medical Tourism Association is doing a fantastic job in terms of educating payers, hospitals, and everyone. And today we both touch and what a center of excellence truly look like. And yes, there is abuse on the word of center of excellence, but very little understanding of what it is and what it has to deliver. So again, the job that you're doing in terms of educating the different stakeholders is going to help for people to understand when somebody's talking about center of excellence, to actually look for what a center of excellence should be and what it should deliver. I think that is the first step. And I can tell you that if we continue doing this, the market is going to understand that they cannot continue selling a proposition that is not up to the standards. And it's also, again, for us as payers, for example, the hospital quality program that we have in Bupa, last year we moved from a general assessment of quality for a provider, we moved to develop tools to assess and evaluate what a center of excellence is. So we developed 3 modules. One to understand what a center of excellence in oncology should look like, and it's a questionnaire with an on-site visit. It's a throughout evaluation of how a center of excellence for breast cancer, for colon cancer should look like. Also, we developed one for cardiovascular and another one for spine surgery and orthopedics. So we're developing these tools internally and working with providers to make sure when we're saying this is a center of excellence, it's a true center of excellence, and it's not a marketing tool.
No, I think that's extremely important, and that's great that Bupa is kind of setting that standard in the industry. We had a question from a gentleman from Kalal Insurance, and they own I think the majority of the market share for travel insurance in Israel, and they asked, is it possible for a company like theirs to be able to partner with Bupa to offer all their travel clients, IPMI?
Yes, definitely. They can just reach out to me. My information is on the Bupa website, and I'm more than willing to look into that.
Okay. We have another question that came in that said, in Africa there's a lot of, healthcare challenges and a lot of where the insurance market kind of lags behind other regions in areas of health insurance projects to health insurance coverage to corporations and to expats and local employees. What is Bupa doing in Africa?
We have a very strong presence in Africa and the IPMI market. We're working with certain partners to provide funding services. And I also can mention that on the hospital quality program, we're also working with providers in Africa. Recently, we worked with a few providers in Nigeria to evaluate how they handle blood transfusions. And we share with them what are the best practices for blood transfusion. And that is helping providers to minimize risk in that type of, for that type of medical services. So if you see, it's not only us getting involved in selling funding products, but it's also us helping these providers to improve their quality, and that would have a very strong impact on the population. Even the majority of that population are not Bupa customers. However, they are they're getting benefits every time they walk into an emergency room or they go to one of these hospitals. The policies that we have helped implement are helping them to have a more safe journey with these providers in terms of blood transfusions. So Africa is I didn't mention that in my presentation, but Africa is one of the markets for the future, and definitely we want to have a stronger presence in the next few years in that region.
Now, are there any what do you see as the biggest emerging region or continent for IPMI in the Center of Excellence model?
As I mentioned in my presentation, Latin America it's a huge market. We have countries such as Peru, Colombia, definitely Brazil, Mexico, Ecuador. Those are countries with booming economies. Those are countries where there is a very strong middle class and looking for quality of healthcare services. In Asia, definitely Singapore, Hong Kong, Beijing. Again, booming markets, strong middle class, looking for high quality of care. You look into China, some of the public hospitals, they have a private wing where they can fast-track patients. They can help them with their needs. What needs to happen in these two important regions is that we keep doing events like this where everybody understands what a center of excellence is, why quality is important, and together with the funding, we're going to see an increase in the provision side to a different levels of quality, a different level of access, and therefore these are regions that we really need to keep an eye on because they're going to be at a different stage in the next few years.
Thank you for that. And do you have any, I think that kind of ends all our questions that came in. We're going to, as I said earlier in the webcast, it'll probably take us about 48 hours. We're going to combine the video with the PowerPoint and make it available and email it to all the participants. But if you have any questions, you can also email your Jose directly. Anything else you'd like to cover, Jose?
No, I think we covered a lot today. This is a topic, again, that we need to continue having conversations and discussions. And thank you, Jonathan, again, for this invitation.
Thank you, Jose. And I think it's really important what Bupa is doing because, from the Medical Tourism Association perspective, we're, been advocating, and one of our core tenets is transparency and quality and pricing. And the biggest challenge, I think, for global healthcare consumers, for employers, multinationals, expats, is not knowing where do I go for care. I remember 2 years ago at our conference, we had one of the largest IT companies in the world that has operations all over the place, and their director of global benefits was there. And they said the issue was they have employees from all over the world that contact them with, major health conditions. And she didn't know who to turn to. She didn't, her health insurance company was not a resource for her to determine what are the centers of excellence. So I think it's really great to see Bupa kind of stepping up and, showing the world that, an insurance company can do this and provide more transparency and quality and kind of bring the hospitals along with that. So with that, thank you, Jose. Excited. I'll see you very shortly in about 2 months in Las Vegas. And thank you for the presentation.
Thank you, Jonathan. Have a good day.
Everyone, take care.